Dr. Saunders. She told us how a regular check-in, even something simple, can make a big difference.
So let's do it. Dr. Laura Saunders joining us today. How are you? Happy Thursday, Dr. Laura.
Hello, friends, and happy Thursday.
How are you?
I am well. Thank you for asking.
That's good. All right, so a task for the U.S. Preventative Services, which works with the U.S. Department of Health and Human Services, is now recommending all adults 65 years or younger be screened for anxiety. What do you think of this proposal?
And what does that mean?
Yes, so great questions. Absolutely. I think that, this recommendation is a great way for people to become more aware of their, of anxiety, right? It's a screening tool that primary care doctors would do during your annual visit. And it would bring a tremendous amount of awareness to what anxiety really is, right? It's stressors, it's ways of thinking, it's ways of managing stress that is outside of what would be typical. So these brief screening tools have really been developed to screen anxiety. They're available for use in primary care. And I think it's an amazing recommendation because many people struggle with anxiety and they think that that's just the way that they have to live, and it doesn't have to be that way.
Absolutely.
It becomes more of a normal, quote unquote, right, normal part of people's daily lives, and they just expect that that's what they should be dealing with, almost like suck it up and keep on moving because that's what everybody, what's that, like rise and grind culture, you keep moving. But having these kinds of screening processes in place, having those conversations with doctors, what do those questions look like for people as they go into their primary care offices?
Right. It's what they want to look at is are there ways that you think or behaviors that you engage in that hinder your functioning? Is it hard for you to leave the house because you're worried something will happen? Do you not let your child out of your sight because you just worry excessively something bad could happen? Is it hard for you to leave the house because you have to check the gas burners over and over and over again before you exit, right? So there's ways to ask questions and realize that these symptoms can be absolutely debilitating for people. And there are certain demographic factors that make people more likely to have anxiety. We know that females are a little more likely to have anxiety. Psychosocial factors, stressful life events, actually smoking and alcohol use increase anxiety. And other physical conditions, other medical conditions also increase the risk for anxiety.
All right, so I guess if everybody has to do it, it would decrease the stigma surrounding mental illness. Is that right?
Absolutely. The more we talk about these things, it creates a dialogue, it decreases stigma, it lets people know that there's many, many people that struggle with anxiety within a wide range, right? Some people manage their anxiety and just go about their day, but it makes their days harder. And so if there's things that we can do, ways that we can alter our thinking that will decrease stress or help us to manage the stressors that we have to deal with in the day, why not do something like that?
So, Dr. Saunders, this sounds like a really great start to have a baseline conversation and have everybody, all adults basically get these checkups. But what do you do at that point if you feel like you have too much anxiety that you're dealing with?
So if you feel like your anxiety is debilitating for you, you need to start somewhere. You can start with your primary care doctor. You can ask that individual. There's lots of treatment. I mean, cognitive behavioral treatment is the most well-researched treatment for anxiety disorders. So cognitive behavioral therapy has proven to be very effective. In some cases, pharmacotherapy or medications might be effective. There's also relaxation, desensitization, meditation. There's a lot of very effective treatments for anxiety. It is very well researched. Check with your primary care. There's lots of, private practice clinicians or clinics out there, but get some help.
All right, Dr. Laura Saunders, psychologist and director of the Center for Gender Health at the Hartford Healthcare Institute of Living. Thanks for checking in with us. We always appreciate your time.
Yeah, thanks, Dr. Saunders.
Have a great